afternoon, everyone. Thank you for joining us today. Hi, I see a lot of hands waving. So good to see you all here. My name is Dr. JJ Rawlinson, and I'm the Senior Manager of Community Partnerships and Welfare Initiatives at Annenberg PetSpace. We are really excited to bring you the second session of our new PetSpace Wellness Workshop series. The recording of our first one can be found at our website and on our YouTube channel. It was really great. These sessions are designed to directly help you strengthen the human-animal bond between you and your pets. Through the guidance of animal experts who will explore practical, everyday issues for pet parents, such as today's topic, a personal favorite of mine that most of the staff at PetSpace know, pet dental health. We are excited to welcome Dr. Jenna Winer, who will be giving you an in-depth look at the regular upkeep and care needed for your pet's oral health. So we're going to begin with a presentation from Dr. Winer, and we'll have time for Q&A sessions afterwards, so please hold your questions until after the presentation. Before we begin, we'd like to remind you that we are currently offering adoptions by appointment, and we have expanded our online daily program offerings. Additionally, we are thrilled to announce, it's been a long time coming, that we are going to be welcoming guests back to our space on Wednesday, July 1st, which is right around the corner. We have implemented lots of COVID-19 preventative measures and processes to help ensure everyone's safety. Please take a look at our website at annenbergpetspace.org for all the dentils. Now we are pleased to welcome Dr. Jenna Winer, who currently works in Culver City's dog and cat dentist, where her practice is limited to dentistry and maxillofacial surgery. Dr. Winer has been involved in 16 scientific publications, 10 of which she served as the primary author. She was bestowed the award for Outstanding Small Animal Research Study and Presentation while in her final year of her residency, and currently serves as a reviewer for several international veterinary journals, including the Journal of Veterinary Dentistry and the Journal of the American Veterinary Medical Association. She also serves on the Los Angeles Zoo's Medical Advisory Board. She has also cared for some of our PetSpace adoptable animals that have needed advanced dentistry in the past, so she is an important part of our PetSpace community. Please join me in welcoming Dr. Jenna Winer.
Thank you.
Doctor, are you there?
Yes, I am just sharing my screen.
Wonderful. Thank you for being here today.
Okay, thank you. So it's definitely an honor to be part of this wellness pet series, and I thank you for that introduction, Dr. Rawlinson. I'm going to launch into my talk now, which is mostly PowerPoint based. I do include many pictures of my actual patients that I've worked on recently. I tried to make sure the pictures weren't too gruesome or bloody, but they do illustrate a lot of the work we do as dentists. And just to let you guys know, I have been practicing dentistry for the past 5 years, and I'm in the process of becoming board certified. Unfortunately, COVID has delayed some of the tests I need to take to obtain that board certification. But I do dedicate every day of my practice to dentistry and oral surgery cases. So, whoops, I'm trying to advance my slide. Let's see. Oh, there we go. So I just have a quick overview of what the presentation is going to cover. First, I'll get into a little bit about what a veterinary dentist is versus potentially what a regular veterinarian can accomplish with dental care as well. I'll cover the importance of regular oral exams on your dogs and cats to ensure they have the healthiest mouth possible. I'll also review some signs of dental or oral disease, things you can potentially pick up from home as a pet owner that may alert you to there being an issue. And I'll specifically highlight some signs of oral pain because sometimes that can be a bit tricky for people to pick up on. I'll also go through some specific case examples of some pets when the teeth are the problem versus sometimes we can get a little bit tricked and it's not always the teeth that are the issue. And then I end the presentation with what you can do from home. So some home care instructions and tips. And then also sometimes what we can do from home is limited and when it might be a good idea to actually partner with your veterinarian and pursue dental care on a veterinary level. So just to give a bit of information, there are very few veterinary dentists. There's less than 200 in the world. This map highlights the ones located in North America. The American Veterinary Dental College, or AVDC, is our governing body, and that is the organization that bestows the title of a dental specialist. Dental specialists are highly trained in dentistry specifically. We do the regular 4 years of veterinary school, a year of internship training, and then 3 years of advanced residency training. So we can perform some procedures that a regular veterinarian isn't able to, whether it's something advanced like saving a tooth with a root canal. We also do surgery to cure and treat jaw cancer, broken jaws, those sorts of things. But also I treat just kind of regular periodontal disease, so dirty teeth, rotten teeth, painful teeth. Your regular veterinarian can also perform a lot of dental procedures, including cleanings and extractions. So some of what I do does overlap with what your primary veterinarian can perform, but then we also, as veterinary dentists, can take things to the next level. So to go into the importance of an oral exam, the oral exam is part of your pet's regular physical exam. So every time you take your cat or dog to your veterinarian, they really should be performing a good oral exam. Typically, the recommendation is to take your pet to the vet every 6 to 12 months. In general, a younger pet at the very beginning of life, a puppy or kitten, should be going in pretty frequently for vaccines and wellness visits. A younger dog maybe needs to only go in once a year for exams and checkups. And then as your pet ages, it is important to keep up with their care and potentially go into the vet every 6 months. And during these points of contact with your veterinarian, they can perform a good oral exam. I also encourage people to go in specifically for an oral exam if something that has changed with their pet. So for example, a little bit of dog breath is kind of something we expect and know is normal. But if the bad breath is progressing, so if they're really starting to get bad breath out of nowhere, or it's becoming stronger or more of a rancid smell, that can indicate dental disease or even an infected tooth. So I do recommend that prompting a vet visit. Sometimes people can pick up on specific pain or discomfort originating in the mouth, and that would also be a reason to prompt an oral exam. And again, I will go into some of those symptoms you may see of pain or discomfort. And also it can be something as subtle as a change in an eating habit. So maybe your dog used to chew and now you're noticing they're more swallowing their kibble whole, or they have a preference suddenly for softer foods, your cat or your dog. They may be chewing more with one side of the mouth and favoring a side. So these are some subtle things we can pick up on as pet owners that may prompt maybe a veterinarian should get involved and look in my pet's mouth. Next, I'm going to go over some of the things that can be caught or picked up on an oral exam. So what I look for when I look in all of my patients' mouths, and what your veterinarian that you work with on a regular basis can also see when looking in your pet's mouth. So one of the main things we can catch is periodontal disease. Periodontal disease is the #1 most common disease that affects dogs and cats. It starts off as gingivitis, which is gum inflammation, and tartar buildup, or what is known as calculus. And this is what we battle ourselves on a daily basis when we brush our teeth. So you may have seen some toothpaste commercials. They're talking about gum inflammation and tartar. That's what we fight when we brush our teeth. And that same disease process can occur in our cats and dogs. When the periodontal disease progresses, the way the tooth is actually attached, so embedded in the tooth socket and attached to the gums and the bone, that can erode away and the teeth can become loose. So definitely having a loose tooth would be a sign of a pretty advanced stage of periodontal disease. If periodontal disease is caught early, it can actually be treated and is somewhat reversible. So I have a before and after picture on this slide, and it just highlights an upper back chewing tooth in a dog. So 2 teeth, actually, a premolar and a molar. Before the cleaning, we can see that there's some brown, kind of gunky calculus tartar stuck to the tooth surface. It's no longer that nice white shiny enamel layer showing, and there's some redness and even bleeding to the gums. Then in the after picture, we can see the tooth is again now a nice shiny white color. There's still a little bit of redness to the gums, and that's because the cleaning itself goes up under the gums, but in a few days, even that redness will really die down and be tamed by the cleaning. So periodontal disease is one of the most common diseases we see as veterinarians and as a dentist in particular. Here are some additional examples of periodontal disease. The stack of photographs on the left is showing, again, another before and after on a patient that had a bit more advanced tartar accumulation and some pretty puffy gums, the ring of pink tissue right around the base of the tooth that you see. And so the cleaning immediately afterwards does show what we can accomplish with a nice deep cleaning under anesthesia. The picture on the right is more of an extreme example. This pet has very advanced periodontal disease. The teeth almost look more like rocks than teeth. There's a bunch of calculus and even some kind of pus accumulation at the gum line. So once we see periodontal disease at this level, it's very hard, if not impossible, to save those teeth. And this dog, unfortunately, did need all of them removed, which sounds pretty extreme. But if that's what's best for the pet to eliminate that discomfort and infection and pain, then that's what unfortunately sometimes does have to be done. But we always love to see as veterinarians catching disease earlier in the process, because early treatment and prevention is much better than having to catch up to a bad disease process and overcome it. We can also see on oral exam broken teeth. So the next category of disease is endodontal disease, which is broken or dead teeth. Many of our bigger dogs are pretty vigorous chewers, and unfortunately, if they're given hard items to chew on, they can break or fracture their teeth. The picture on the left, the before, does show a broken tooth, and in the dotted circle, we can see pulp exposure, which is a pink dot that represents the inner nerve and blood vessel of the tooth. So I like to describe teeth kind of like an apple to pet owners I'm speaking with. There's three main layers to the tooth, just like there's three main layers to an apple. There's the very thin peel of the apple, which represents the enamel of the tooth. And just like the apple, the enamel is smooth and shiny and helps protect what's internal to that. But it's a very thin, delicate layer. Then the majority of the tooth is dentin, which is like the fruit of the apple. It's, of course, a tooth is much harder than an apple, but the dentin is more soft and porous than the outer enamel shield. Then the core of the tooth is where the inner nerve and blood vessel are, and that's what's actually keeping the tooth alive and giving the tooth sensation. And once the tooth is broken enough where the inner nerve and blood vessel are exposed, that tooth is going to die, or it's in the process of dying. This is a pretty fresh fracture in this photograph, so there's still some pinkness to where the fracture is, but over time that blood vessel and nerve will die, and there'll be like a little black hole there where they used to be, and that's a tunnel where bacteria can enter the tooth and cause a tooth root abscess. So when we do notice broken teeth like this, they do require treatment. In this particular patient, the owner elected to save this tooth rather than extract it, and so I performed a root canal. And you can see on this after photograph what the tooth looks like after the root canal has been performed. And just that circle again now corresponds where that exposed nerve and blood vessel were. Now there's a white filling kind of capping off the root canal treatment. And if you're curious, the x-ray shows actually what a root canal entails. So I've cleaned out the 3 canals on this 3-rooted tooth and placed the substance that looks white on the x-ray as like the filling or the root canal material to block off infection from being able to enter the tooth and form infection around the roots. Another sign of endodontal disease or dead teeth is when they become discolored. So a tooth potentially could be traumatized, so hit, not hard enough to crack it or break it, but enough to bruise it. And unlike a bruise on our leg, which has a lot of additional circulation a tooth, the inner nerve and blood vessel are confined to a very tight tunnel. And if there's any sort of swelling, the blood supply to that tooth can be cut off and the tooth can die. So we see here the circled teeth are discolored. The picture on the left is a certain patient with a discolored tooth, and the picture on the right is actually a different tooth, an upper canine, that has a little white circle showing I did a root canal on that tooth as well to save it. So there's that white dot. We can also see problems in even young puppies. So some people may think, well, I just have a puppy, you know, he hasn't even had a chance to develop periodontal disease or a broken tooth. And I've actually been seeing quite a few puppies recently because everyone's getting a puppy since they have more free time, which is wonderful. But I've been seeing actually quite a few that have malocclusion or an off bite. So puppies, they can have developmental issues, and even in kittens too, where a tooth may be out of alignment and actually be causing pain or trauma. So this puppy in particular, we have the abnormal side, which shows the little lower canine tooth stabbing into the gums, which can create multiple problems, you know, including, of course, discomfort. This puppy, the other side, oops, going back, the normal side, you can see where that tooth should be, but on the abnormal side, it's actually poking in. Oral exams can also, unfortunately, show us cancer. This particular patient I remember very well. It was a dog I saw in my residency, a 10-year-old dog, and the owner just thought, oh, it's time for a routine cleaning. It's been maybe a year or two, and they just came in for normal routine deep cleaning of the teeth. And always during my oral exam, I not only look at the outer surfaces of the teeth, but I look at the inner surfaces, the tongue, as much under the tongue as possible, and then also the roof of the mouth. And in this particular dog, when I looked at the roof of the mouth, I noticed this black growth, which can indicate a cancerous process potentially. So, you know, unfortunately, the conversation had to change with that owner from just, oh yes, a routine cleaning, no big deal, to, oh my goodness, we need to change gears. I'm afraid your dog may have cancer. And this did turn out to be oral cancer. It was melanoma, which dogs can grow in their mouth. So I have that circled here in case it wasn't totally obvious. The growth there, about 5 to 7% of all cancers in dogs and cats do occur in the mouth, depending on which study you're citing. So we do see cancer in the mouth on a relatively regular basis. And sometimes we see the pet because it's already so large that it's grown and become more obvious. But sometimes we get lucky and actually can catch these when they're small. And in this patient, we caught it early enough that I was able to do a special surgery to remove a small part of the dog's upper jaw and roof of its mouth and actually cure it of this cancerous growth. So it was actually fortuitous that the owner came seeking regular care and we were able to catch this when it was still pretty small. So now I'm going to transition into some signs of oral or dental disease that you could pick up from at home that may prompt you to have a discussion with your veterinarian, prompt them to look in your pet's mouth and potentially see if they can pick up on an issue. So oral pain, I will discuss a bit more on the next slide, but there are various signs of pain you may pick up in your cat or dog. There's some other signs too you can notice. So sometimes a cat or dog will begin to drool more than usual or smack their lips around. I will say that those two signs in particular can also be associated with nausea. So they're not 100% a clue that there's definitely something wrong with your pet's mouth, but something worth picking up on. I've touched on this a bit already, but if you start to notice bad breath in your pet, particularly if it wasn't that bad in the past or if it's changed or gotten worse. I've had a few people come in recently because they've noticed more of a rancid smell, and it is correlated with their pet having a tooth root abscess or infection. People also sometimes notice oral discharge or bleeding, and that can indicate anything from severe gingivitis or gum inflammation to sometimes there is a growth or cancerous process in the mouth that starts to bleed. And pets can also develop facial swellings. So swelling, particularly if it's underneath the eyes or on the sides of the muzzle, that can indicate a tooth root abscess or infection that can manifest as a facial swelling. I have decreased appetite at the end of the list and kind of faded because that can also show that there's a sign of dental issues. But I will say a lot of our pets are very resilient, and some of the dental disease they have has been brewing for years, and they've been coping with it for a long time, particularly periodontal disease. It's one of those issues where there's a little bit of tartar buildup, a little bit of gum inflammation. It can get worse, of course, over time, but they've been coping with that for a while. So if there's a sudden change, it could potentially mean that there's a sudden disease issue that's come up. So a sudden tooth infection that's formed, or a sudden tooth that's broken. But more realistically, I find that most pets actually hide that from us quite well. And a decreased appetite could hint that there's something going on more internally, a systemic disease. So I do find a few pets where they come in and decreased eating is actually correlated with dental disease, but a lot of times that's a fake out and it's not the most reliable sign we have. But people like to jump to the teeth when their pets aren't eating as much. So specifically oral and dental pain, it can be very obvious in some animals. Some animals are very stoic though and hide that pain from us. So I have a list here, and some of the items on the list correlate or correspond more to what you would see in a dog versus a cat. Some of these symptoms overlap, but they can all potentially indicate that there's some oral pain or discomfort. Again, changes in eating habits. So if your pet used to vigorously chew its kibble or love eating hard treats and cookies and biscuits, and now it's not chewing as much or shying away from those hard treats, that can be a sign of dental pain. Also, if they have a preference for softer foods all of a sudden. Jaw chattering or teeth grinding can also be a sign of oral pain. And chattering is basically when they kind of shudder their jaw. And that can indicate that there's a painful tooth. Sometimes animals will paw at their face, particularly during or after eating. This is a sign that we see in both cats and dogs, and it can indicate that there's some pain when they're eating. A decreased interest in toys may also show signs of pain because they're not wanting to use their mouth as much or bite down on things. Decreased yawning can be a sign that potentially there's an infected tooth towards the back of their mouth, and when they yawn and open their mouth wide, it puts pressure on that infection or a pocket of pus. It can also be a sign of temporomandibular joint arthritis or pain, or TMJ pain, which is something that people get as well. Particularly in cats, they can hiss or run away from their food when trying to eat it. And that's a pretty surefire sign that there's something going on in their mouth, whether it's their teeth or further down in the back of their throat, but some sort of inflammation in their throat or mouth, excuse me. And dogs can also show signs of pain by yelping. A lot of owners tell me that their pets suddenly head shy. They used to be able to pet their dog on the chin or on the side of their face, or rub their cat's chin, and now the pet is shying away from that and really not wanting its head to be petted, and that can also be a sign of oral pain. And then some of the symptoms can be more vague, so hiding more, acting tired or lethargic. Something pet owners tell me very frequently is if they bring their pet to me and I diagnose really severe periodontal disease in their older small breed dog, and potentially the dog or cat may need many extractions. At first, that can be a very distressing thing to an owner, and I completely get it. It's a lot to put a pet through, and we like to try to think that our pet's gonna, not need to lose any teeth in their lifetime. But I do often reassure people it's much better to get rid of a painful tooth than leave it behind. And in some of these dogs where I do extract the majority of their teeth, or maybe even all of them, a lot of times at the 2-week recheck, the owner will say to me, wow, my dog is acting like a puppy again. And it can be a slow creeping issue where it gradually builds, that they're having some discomfort or pain. They mostly hide it, but they kind of cope with it. Maybe they're slowing down a bit. And a lot of people just attribute that to old aging. But in reality, for some of these animals, after they've gone through some pretty major dental work as far as how many extractions they need, they're up and energetic, better than ever. So sometimes those signs of just kind of slowing down, acting older, being more tired, hiding, sleeping more, those can also be subtle signs of discomfort or pain. And then I do have at the bottom of the slide the word stoic, because many of the animals I see, I would say maybe 75%, there's a known issue in the mouth. I see there's a broken tooth, or I see there's a tooth that definitely needs to be extracted. And I asked the pet owner, have you noticed any signs of pain or issues? And about 75% of the time they say no. That doesn't mean their pet's not in pain. It probably means their pet's really good at hiding it. So I like to remind people that no dog wants to be the weak wolf that gets kicked out of the pack. Now, I say it mostly as a joke because, of course, our dogs are not wolves, and we take care of our dogs. Most of them have a much nicer, cushier lifestyle than a wolf would, but they still have that instinct deep inside of them to not show weakness, and they don't want to be that low wolf in the pack or the low man on the totem pole. And cats as well are notorious for being very secretive and hiding their pain and really don't complain. Sure, there are some dogs that are a little dramatic and really let us know, they step on a rock and are limping the rest of the week. We all know dogs like that too, but the majority of them are very stoic. And while certainly if oral pain is noticed, I would very strongly encourage you to reach out to your veterinarian and have them take a look and make sure everything's okay in the mouth. I will also say that even if you don't notice any of these signs, it's still a great idea to have the mouth inspected on a routine basis, because pets really do a wonderful job of hiding their pain from us, for better or worse. A lot of times they don't really express that pain as overtly as things we can pick up on. And it's a blessing that our dogs and cats are not constantly complaining and nagging us, but also sometimes it'd be nice to have a little hint and have them just say, hey, I'm in pain, can you help me out? So now I have a couple of examples. This is probably the bloodiest picture I have in the presentation, so sorry for people who are squeamish. But this is an example I did want to highlight to you guys when it is a dental problem. So this is a kitty named Simon, and he's a really adorable snowshoe cat. He is indoors only and about 14 years old. And for about a week or two, he had been hiding and a little bit lethargic and not as social and talkative as he usually was. And then all of a sudden, the owner noticed this very dramatic bloody wound on his left cheek. And she wasn't sure what was going on. Did he get scratched? Did he get poked? Did her dog bite him? She was really worried. She took Simon to her regular veterinarian, and they said, I think this is the teeth. You should go see the dentist. So I got to see Simon, and long story short, it was the teeth. So pets can have such severe dental infection that the pus can be brewing under the gum line. We don't really notice anything necessarily, but at a certain point, the pressure will build up so much that the pus pocket ends up rupturing, or kind of exploding, if you will. And it will rupture in the path of least resistance, which is often out the side of the face through the skin. So when we see wounds on the side of the face, particularly right underneath the eyes of a dog or out the side of the cheek on a cat, it can indicate that there's a severely infected tooth and the pressure built so much that it just exploded. So I did see Simon for this facial wound, and just to kind of cut to the chase so everyone knows the story has a happy ending, I have a picture of Simon's face 2 weeks after he recovered from surgery, and he's looking great. You can see his eye looks, he looks much brighter and happier. Even it's a little hard to see his ears because my hand's kind of blocking it with the glove, but his ears are nice and perky. When he looks like he's in a good mood at the recheck exam. His facial swelling's all gone. And he just has a little bit of a scar there where the fur needs to regrow and cover his cheek. But with Simon in particular, I have a picture of what his teeth looked like. So on the left is a picture of his teeth, and you can see there's a lot of calculus glommed onto those teeth. They don't really look nice and shiny and white anymore. It just looks more like that thick tartar buildup. There's even a little bit of pus. I don't know if you guys can see my mouse, but a little bit of pus accumulated at the gum line. And these teeth were so badly infected that that infection did migrate up and out the cheek. On the right, I do have a picture of a different cat, just as a normal comparison, so you can see what those teeth should ideally look like in a cat with healthier teeth. So we do see quite a dramatic difference between Simon's teeth and this cat's teeth. So this was a happy ending. I know it was a little dramatic, and poor Simon did have to go through some pain, but we were able to make him feel a lot better by getting rid of those infected teeth. And again, Simon's teeth versus the normal. Now I do have a quick example of when it's not the teeth to blame, and certainly I'm not trying to dissuade you from being up on your pet's dental care, but it is important to not just jump to conclusions and to really work with a veterinarian to see, could this be the mouth, could this be the teeth, or could there be something else going on? So this is my patient called Blue Moon. He's a very sweet 10-year-old Labrador Retriever. And the story is pretty fresh in my mind because I probably saw Blue Moon just about 3 to 4 weeks ago. His owner did a lot of traveling, and he had come actually this most recent time from Florida all the way to Los Angeles with Blue Moon. But he didn't necessarily keep up with regular veterinary care because he bounced around from state to state so often. But he did start to notice about 2 months ago when he moved to LA, Blue Moon's appetite seemed to go down, which is pretty unusual for a lab, because if any of you have labs, you know they live to eat and will eat almost anything. So his appetite was waning. He was a little bit tired, but the owner just put him through a big cross-country move. They drove across the country together. And then as well, the normal brand of dog food the owner purchased for Blue Moon wasn't available, potentially because of some shortages with COVID, and the store wasn't carrying that brand. So he had switched the food around a little bit, and he didn't know if that was partially to blame. So he brought Blue Moon to me because he said, I think it's actually the teeth. He took a look in Blue Moon's mouth and he saw this. And so this is what now I saw during my exam. So Blue Moon does have quite a bit of dental disease going on. He has pretty severe calculus or tartar buildup on the teeth. We can see they're not that nice white shiny color anymore, looking kind of gray. And then there's actually even some ulceration to that inner lip lining or the mucosa. And we do sometimes see that when there's so much tartar buildup on the teeth. And I probably didn't say this already, but tartar is actually a layer of bacteria that grows and lives on the teeth. So when those delicate mucous membranes are constantly rubbing against that layer of bacteria, it can cause inflammation and ulceration, which is pretty painful. It's kind of like a canker sore, but even worse. So I looked in Blue Moon's mouth and I told the owner, he does have significant dental disease. He's 10 years old and has never had his teeth cleaned before. So maybe it is the teeth, but again, a lab is, normally going to eat no matter what's going on with it. And this isn't a new issue that developed overnight or even over the past 2 to 3 months. He's had tartar buildup for a while. This is a slow chronic process. So I said, certainly we'll look into things, but definitely the place we need to start is some blood work because the cleaning's done under anesthesia and we like to make sure that their internal organs, their liver, kidneys can cope with the anesthesia medications and also the pain medications I would be sending home after the procedure. So it turns out that when I did Blue Moon's blood work, unfortunately, he was in kidney failure. And that was actually what was to blame as far as his decreased appetite. With kidney failure, it will cause decreased appetite, nausea, and also Blue Moon had been a pretty chubby lab, and now he was at a very slender weight, which shows some chronic weight loss, and kidney disease will also cause that too. So the teeth do have dental disease there, certainly, and it's not something to be ignored. But if I just launched into treating him and putting him under anesthesia and cleaning his teeth, I wouldn't have really gotten to the bottom of the issue, which the kidney disease is much more important and unfortunately life-threatening ultimately, or life-shortening. And also putting him through anesthesia could have made the kidney disease worse. So again, I'm not trying to use this example to, scare people away from dentistry or to not put importance on the teeth, but it's important to think of the pet, their, entire health. And I really, even though I love dentistry, of course, I've dedicated my career to dentistry, I don't just look at the mouth in isolation. I try to think of what else could be going on with the patient. Is there something else that could be contributing? And also, kidney disease can also cause ulceration of the mucous membranes and can make tartar buildup occur faster because it makes the mouth drier and makes it a more, predisposes the mouth to being an environment where bacteria live more. So again, it's important to think about your pet on the whole and to work with your veterinarian to make sure your pet's healthy overall. And if it is, then of course we can focus on making the mouth and the teeth as healthy as possible. So now that we know how important taking care of our pets' mouths are and dental disease and what a veterinarian can pick up on an oral exam, I also want to empower you guys to do what you can to keep your pet's teeth healthy from home. So I'm going to review a little bit about Home Care 101 and what you can do to be as proactive about your pet's health, oral health as possible. So I'm going to review some toothbrushing strategies and teach you a little bit about a website that I recommend, vohc.org. And then I'm also going to point out some items to specifically avoid and what could be a more appropriate like toy or chew toy to offer instead. So that's a bit of an overview on the home care section. So toothbrushing. It's a conversation I have a lot with people because what I tell people is toothbrushing is going to be the most effective way to take care of your pet's teeth from home. It's what we do ourselves to battle back that tartar and gingivitis. And it's the same disease in us as our dogs and cats. So if there was some sort of magic pill or magic way to avoid needing to brush the teeth, I'd rather not brush my teeth for 2 minutes a day myself, but it is what's most effective, and it is what's most effective for our pets as well. I do realize though it's a challenge to brush a dog's teeth, and challenge is an understatement when it comes to cats. So I do encourage people to try brushing their pet's teeth, but I also am realistic about it and don't shame anyone for not being able to. There's a lot of factors. Some dogs are just not going to be very amenable to brushing. Some breeds in particular are extra tricky. So some of those little squishy face breeds like Frenchies and Pugs, they're very popular and I see why they're completely adorable. But those breeds in particular are already prone to having some breathing issues, and they can get stressed really easily if you're coming at their face and doing anything to make that breathing even harder for them. So some of it's breed related, some of it's personality related. Some dogs and cats are just not going to let you brush their teeth. And sometimes, owners, we have our own busy schedules. We can barely have enough time to brush our own teeth, let alone our pets, especially if we have multiple pets. So I do realize that teeth brushing is a big ask, but a lot of the people I work with are very motivated to try and at least see if it's something that can be accomplished. So when people ask, I do recommend that a dog's, and potentially cat, but especially dog, that their teeth be brushed at least every other day, ideally daily. Now that is for tartar control and gingivitis. There was a paper published that showed if a dog's teeth is brushed less frequently than every other day, it's almost as if you're not brushing at all with regards to fighting back tartar and gingivitis. So if we can get in the habit of doing daily brushing, that's the best. And it is teaching an old dog a new trick. So, you have to get them to stay and be calm and tolerate it. So, it's a project, I would say. The best is if you're in the market to adopt a new dog or a younger dog, especially if you're getting a kitten or a puppy, is to start them from the very beginning. And just like you're having to teach them to sit and stay, you can also teach them to sit still for brushing and tolerate that. The toothbrush is the best toothbrush is actually just going to be your run-of-the-mill drugstore human toothbrush. I recommend pediatric toothbrushes for small breed dogs and just regular human toothbrushes for big breeds, because the bristles themselves are really what's doing the work. Definitely get a soft one, so not the medium or hard. They do make over the finger brushes and a few things like that too. If that's what's working for you, great, but the best really is going to be those bristles. And again, I always bring it back to what works for people has been honed for the last, 100, 200 years. That's what's going to be the most effective, and to translate that to our furry friends. The toothpaste itself doesn't do a whole lot as far as cleaning the teeth necessarily, but it can make it taste better because pet toothpaste is normally beef flavored or chicken flavored. So it can make it a more pleasant experience for them, just like we like the minty flavor of our toothpaste. So it can make it more like a treat. And then this Pet Smile is the toothpaste I recommend most. And it does have, if you'll notice, that little yellow square, the VOHC seal, which I'll get into next, but that means it's an approved, tested product. The last thing I'll say about toothbrushing is, even if you can't do it daily or every other day, I know that's a big ask, I still encourage you to do it even once a week, once a month. You may not get quite the same benefit as if you're doing it daily as far as tartar control, but that being said, it's getting you in your pet's mouth. And what I like to tell people is I recommend toothbrushing for 2 reasons. One is to help fight back that dog breath, that tartar, that gingivitis. The other reason is to get you used to what's normal for your pet. So it's getting you in there to see, what are the teeth supposed to be looking like? And then you may notice suddenly it looks different, maybe it broke. Or you know what your pet tolerates. So, some dogs are going to be squirmy no matter what. But maybe you have a dog who actually is pretty tolerant and allows you to brush. And then all of a sudden, out of nowhere, he's acting really painful when you try to brush his right side. Or it didn't used to bleed and now it's bleeding. Or something didn't used to be loose, but now when you're brushing, it's loose. So it gives you a little bit of a baseline and more information to go off of, so that if you start to notice a change, it may prompt you to realize that your pet needs more advanced care than just brushing from home. And maybe you do need to go into your vet to get that taken a look, get that looked at. So I recommend it for that reason as well, just getting to know what's normal for your pet and if you notice any changes there. So I mentioned VOHC.org. It stands for Veterinary Oral Health Council, which is written out in that little white square on the bottom. So this is an independent organization that tests the claims of different products. And in order to make it onto the VOHC website and to have that little seal of approval on the product, just like the toothpaste did, an independent study has been performed, and it's shown that that product has reduced plaque and calculus or tartar or gingivitis. So these products have gone through a testing process, and they're therefore scientifically shown to make a difference in your pet's health. Granted, the criteria for being approved is they only have to reduce tartar buildup by 20%, which means 80% of it, up to 80% of it may still be there, but it is a scientific difference there that they've shown. So certainly better than nothing. So if you're gonna reach for a product, like if you can't brush your pet's teeth, but you want them to take some dental chews or dental treats, you might as well be reaching for one that's been scientifically studied and proven to be effective. Because you might have seen the talk from the nutritionist. I mean, there's not a ton of regulation out there on treats and foods and how they can be labeled. So marketing, they can say, will help your pet's breath or will reduce tartar, but that doesn't mean it's been scientifically proven. So this website, if you visit the website, they list certain products. There's toothbrushes and toothpaste, just like Pet Smile. There's also specific diets that have been studied and shown to reduce tartar buildup, specific chew treats. There's also a few other things that I listed towards the bottom, so like gels and sprays and wipes that you can actually apply to the teeth, or even things you can mix in the water. Now, I will say I kind of organize these things by like efficacy. So nothing's going to replace toothbrushing. That's going to be the most effective. A diet can also be very effective. And as we go down this list, certain things like a water additive, even though it made the website, I'm a little dubious as to if that's really going to have a huge impact. None of these things will hurt your pet, but nothing's going to be quite as good as brushing. But they can be supplements or, better than nothing. The diets in particular on the website, I have some of them highlighted here. So there's 7 diets that have been approved for dogs. 3 are available over the counter, and I have photographs of each of the bags on this screen so you can just get an idea. So these are over the counter, meaning you can just go by yourself without a prescription and pick them up from your local pet food supplier. There are 4 diets that are prescription only that you can also work with your veterinarian to have prescribed. And the way the diets work is that they use a combination of mechanical and chemical action. And when I say mechanical, it's mostly the fact that the kibbles themselves are quite oversized, and it actually forces your pet more to chew into the kibble and really use their teeth. And then it's that scraping action of them really using their teeth and chewing against the kibble. And they're a little bit of a more dense kibble and also larger. There's a chemical component as well, which there are certain chemical compounds that are completely safe to ingest, but they're added to the food as a coating that help reduce bacteria in the mouth and tartar buildup. So some of the diets work by both methods, some of them work by one method, but it's actually proven to help keep the teeth cleaner. So this is an option for some of you out there who maybe are more open to a diet change and want to see if this can be a component of your pet's oral health. They didn't leave cats out, so there's some cat diets as well. There's 5 approved for cats. 2 are available over the counter that you can purchase yourself. Both are by the company Hills, pictured here. And then there's also 3 by prescription only. One's a Royal Canin diet, one is a Purina diet, and then there's actually a Hills prescription diet as well. So now the first part of this, the Home Care 101, was a little bit more about periodontal disease and trying to keep your pet's teeth with less tartar buildup, less gingivitis. What I also see very frequently is those broken teeth, which I highlighted towards the beginning of the talk. So these are some items to avoid because they're notorious for breaking teeth. Now I have pictures, I just got these from Google Images, but we have some raw bones, some marrow bones. Cooked or raw bones will crack a dog's teeth or break them if they chew hard enough. I have a nylon bone pictured there as well. That's going to be really hard. So some of these artificial bones. I have tennis balls on there. Now tennis balls, of course, they're not hard enough to break a dog's teeth, but they're very abrasive. They have that fuzzy outer layer, which if a dog's really gnawing on the tennis ball, it can be very abrasive to the teeth and wear them down. And human tennis balls in particular, meaning the ones you actually would play tennis with, even have a sandpaper layer deep within them. And if a dog's really going to town and gnawing vigorously, that sandpaper layer can rub against the teeth and wear them down. They do make dogs safe tennis balls, which lack that sandpaper layer. They're going to be a little easier for them to destroy as a result if they're really going to town on it. It's a little bit better, but they still have that fuzzy outer layer, which is abrasive. I also have, so long story short, I actually recommend against tennis balls altogether. I have a picture of some bully sticks, which do have a little bit of give to them, but I've actually helped some owners who swear that the only thing their dog chewed on was bully sticks, and they also can break their teeth. I have some pictures of some antlers. Horns are also like horns and hooves. And then even ice can be dense enough to cause a dog to break its teeth. So the main issue with these items is that a dog's tooth, while it may be bigger than ours, it's not necessarily any stronger. And actually dog enamel is only 0.8 millimeters thick. So that outer like shield layer to the tooth. So it's less than a millimeter thick, which is actually thinner than human enamel. So their teeth are not necessarily that much stronger, and they have so much more bite force than we do. So they can bite so hard because they have these huge muscles, especially certain breeds have really developed chewing muscles on the tops of their head and the side of their face that they can use and really bite down hard on these items. So anything on this screen can cause a dog's tooth to crack or break. The argument a lot of owners say to me is, well, I was told or I heard that chewing on these things can keep the teeth clean. And while it is true that the more an animal uses their teeth for chewing, the less tartar buildup there'll be, I really worry about the teeth breaking. Because on the one hand, if you took away these chew items, your dog's teeth may have a little bit more tartar buildup. But that's something that can be controlled. It's not painful to have tartar necessarily, and it can be cleaned off either with toothbrushing or a professional cleaning under anesthesia with a veterinarian. Once a tooth's broken, if it's broken badly enough to have that pink dot of pulp exposed, the nerve and blood vessel, it needs treatment, and that treatment's either going to be removing the tooth with an extraction, which is getting rid of that tooth permanently, or a root canal. And certainly I do root canals all the time. I did a root canal earlier this week on a dog with a broken tooth. So some of these broken teeth can be fixable, but that can be a pretty expensive issue you're facing to either pay for the tooth to be extracted or even more expensive, a root canal. So I'd rather avoid that issue and not let them chew on these toys. So what I tell pet owners is to offer things that have give to them. So we call it the rule of thumb. And anything that you can easily indent with your thumbnail is going to be a better toy. So I have a slide with those items next, but I forgot, I actually have a picture here now of a broken tooth. So I showed you a broken tooth previously. It had that little pink dot on it, and I was able to save it with the root canal. This is that same type of tooth, just on the other side of the jaw. And this tooth is broken. We can see it's a little bit of a fracture or break because the pulp is now blackish brown, rather than that nice pink dot. And then as well, this fracture goes below the gum line. So there's that flake on the outer surface of the tooth, and you can see that crack perpetuates up and under the gum line. And this next picture here shows that I can even use a little metal instrument to partially lift that flake of broken tooth off. So once a tooth is broken this badly, the only treatment option is removing it. It can't even be saved with a root canal. So unfortunately, I do see quite a few pets come in where they've been chewing on a hard item like a bone, the tooth breaks like this, and really the only option out there is to remove the tooth. Really you can't even leave it in there because it's going to become badly infected at some point and be painful and swollen. So I like to prevent this from happening and instead focus on better, safer toys for your pets. This is a picture of a dog who loved tennis balls, and we can see its teeth are all just worn down so much because it had that sandpaper action just wearing against his teeth. So again, this is another consequence of a dog chewing on really hard items. These are some tooth-safe alternatives, and I started to mention this before with the rule of thumb. So anything that's softer or has some give to it is going to be much safer. There's of course a trade-off because softer items tend to be more destructible and not last as long. So part of it is working with your pet, training them, and a lot of those dogs who just super fixate on chewing something hard, it's partially almost like a babysitter. So I think of it a little bit, not to get too controversial, but a little bit of a parent who just flips on the television and let it entertain their kid all day. Your dog is potentially bored and has this energy, and it kind of, burns up that energy by chewing. If we can redirect their attention and energy to playing and exercising, running with us or being more active, going on walks, we can redirect that energy and have them not chew on such hard items and make their teeth. Or we can train them to accept these alternatives as an equal reward. So some soft plush toys, a rope toy, maybe can't necessarily indent your finger into that, but it's soft and pliable and has some give. Another rule I tell people is, if you don't want to use the thumb rule, is would you whack it against your kneecap as hard as possible? So a raw bone, a cooked bone, some of these hooves and antlers, if you whacked it against your knee, it really hurts. But if it's a rubbery, dense rubber toy like Kong brand, then those are going to be safer for the teeth. And then I have greenies as well here, because I know I didn't include very many toys related to cats, but greenies are one of those items that's VOHC approved. So you can see that little white rectangle, and these are great chew treats for cats, and they will reduce tartar buildup on their teeth. So now I'm just going to go over, we're kind of coming towards the end of my time, but very important to just review what care can be accomplished with a veterinarian. So, sometimes home care is just not going to be enough. And it can be, even if you're able to brush your dog's teeth, or cat, like twice a day, and you're super on top of it, even we have to go to a dentist every 6 to 12 months for a touch-up cleaning, and we're always going to be able to brush our own teeth better than our furry pets. So it can be important to go to a veterinarian for dental care as well. The main tool that veterinarians have to keep your pet's mouth healthy is a cleaning under anesthesia. So a deep cleaning, what we call a periodontal treatment under anesthesia. The benefits of the cleaning are, of course, to reduce plaque and calculus, tartar buildup, freshen the gums, get rid of that buildup and disease. When the cleaning's done under anesthesia, there are certain benefits that come with that anesthesia, because I know anesthesia can sometimes scare people. But one of the benefits of being anesthetized for the cleaning is that your pet's going to be perfectly still, which is safer for everyone, that they're not thrashing around. We're using very sharp instruments for some of the cleanings, and it's safer for them if they're perfectly still. And then also anesthesia gets rid of pain. So if any of you have been under anesthesia, potentially for a surgery, you know that part of the anesthesia is to keep you still, but the other part of it is to eliminate your pain. And anesthesia also has an amnesia effect, where you actually don't fully remember exactly what happened, and that's also beneficial. So those are some of the main benefits of anesthesia. Also, when your pet's under anesthesia, it allows us to take dental x-rays of the teeth. And the part of the tooth you're seeing is only about a half to a third of the tooth. And the other half to 2/3 are the roots that are embedded in the gums and in the bone. So the x-rays allow us to see the entire tooth and if there's infection hiding around the roots or some other issue. And now with the x-rays, they have to be still for those. And also for radiation safety, we have to be 6 feet away from the pet as the x-rays are being taken. Just like when we go in and get dental x-rays, the technician leaves the room when they're snapping that x-ray. So of course, for an animal to stay perfectly motionless, they have to be sleeping under anesthesia. The cleaning itself, when the pet's under anesthesia, it allows us to deep clean all surfaces of the tooth. So not just the outer surfaces we can see when lifting the lip, but we can also deep clean the inner surfaces against the tongue, and we can also go under the gums and clean down there as well. Now, a lot of people are surprised when they find out that dogs have 42 teeth and cats have 30. So part of the reason people get kind of surprised by how many teeth a dog has is that a lot of them are hiding very far back in the mouth, and it can be very hard to access teeth that far back when they're awake because their lips are tight, they're moving, and even if you're able to brush well, you may not be getting to those very last few teeth in the very back. So the anesthesia allows us to really get a full, complete cleaning of all 42 teeth or 30 in your kitty. The anesthesia also allows us to place the breathing tube down your dog's throat, which allows us to deliver oxygen the entire time it's under anesthesia. And then as well, it blocks out any fluid from going down the wrong tube. So when we use a ultrasonic scaler, like the one in the picture, you can see quite a lot of water is coming off of that instrument. The water is there partially to keep it cool so it doesn't heat up. And then also it flushes everything as we're cleaning. So it's actually flushing away bacteria and flushing away debris. But we don't want your pet to get a mouthful of water and have that liquid and bacteria all go down into the lungs. So the anesthesia allows us to protect their airway and their lungs with a breathing tube. And then as well, during the cleaning is when we're going to screen for other issues. So the x-rays and the cleaning are going to let me know, is there a tooth that needs to be removed? Is there a tooth that needs a root canal or something else? And if there is some advanced procedure that needs to be done, like an extraction or a root canal, they're already under anesthesia and ready to have that treatment. So it can be just like a one-time anesthesia where the teeth are all cleaned and any problem teeth that need advanced attention can be addressed in that same session of anesthesia. This is just a quick example from where I work. I mostly work with cats and dogs when they're laying on their back because it gives me the best look at their whole mouth. So this is a little yellow lab, or a big yellow lab I treated recently. You can see my nurse's arms kind of reaching into the edge of the picture, adjusting the anesthesia. But basically it's an example of the pet on its back and its mouth's open, ready for treatment. The breathing tube is coming out the side of its mouth and attached to the anesthesia machine, which is mounted to the wall. And then we have a lot of monitoring equipment going the whole time. There's a heating pad underneath the dog, but he's not in contact with it, so it won't burn him, but it generates heat. And we also have additional ways to give heat support. The two blue things on either side of the dog are sandbags to help stabilize him so he doesn't tip over or tweak his back. And then the picture on the right shows the anesthesia monitoring screen. So the green line shows the pet's heart rate with an EKG. The orange line shows the oxygen level, so the oxygenation level, which should be 99 or 100. The blue waves show how much carbon dioxide the dog is breathing out. And then we have his blood pressure in kind of a magenta, pink, purple color. So those are all the things that we monitor on our patients continuously when they're under anesthesia. So they get pretty much the same level of monitoring and care as a human undergoing anesthesia. These are all human grade equipment. And the anesthesia is delivered to him through that breathing tube. He's breathing oxygen and gas. And then the second the procedure is over, we keep the oxygen running, but we turn off the gas and he breathes out a few breaths and wakes back up. The importance of x-rays, I cannot stress enough. I base almost all of my decisions on what needs to be done based on what the x-rays tell me. So this is an example here of a dog's lower big molar tooth. I have it circled just so you know which tooth I'm talking about. The tooth itself doesn't look that healthy. Let's be honest. It has quite a bit of tartar buildup on it. The gums look pretty inflamed around that tooth. But if we were going, if you were going to just brush it at home or have a quick cleaning without anesthesia, they would just clean off the part of the tooth you can see. But the x-ray of that tooth shows a pretty different story. So we can see how long those roots are. And you'll see like a dark gray halo completely surrounding those tooth roots, which is actually bone loss because this tooth has a very, very bad infection around it to the point where it's barely even anchored in the bone anymore. And just as a comparison, in the green circle, we have the tooth just right behind it, which is actually totally healthy. So you can see there's not that big black shadow around outlining the tooth roots. They're actually a lot harder to see because the bone around them is so healthy. So we see just even within this one x-ray, a very healthy tooth in the green circle, and then a tooth that's badly diseased enough that unfortunately it needs to be extracted. But just from looking at it on the surface, we wouldn't necessarily know that. People will often ask me how often a cleaning should be performed. So I really try to pride myself on making custom recommendations for the patients I'm working with. So I try not to have just like a blanket formula. It's not like a vaccine schedule where one size fits all. It's really can be custom to your pet. I will say on average, it's nice to recommend annual cleanings, just as a nice baseline if you really want to keep up on your pet's health. I will say, of course, there's certain breeds. In general, the bigger the dog breed, the healthier its teeth are from a periodontal perspective, because there's just so much more bone that the teeth are embedded in, versus some of these cute, adorable little breeds like poodles and Yorkies and Malteses. Part of what makes them so cute, and Chihuahuas, is their jaws are so tiny and delicate, but that means there's already so much less bone there to anchor the teeth in. So I would say on average about annually, but bigger dogs maybe can get away with every few years. Small breed dogs, I work with quite a few owners actually who are super committed to their pet's oral health. I clean the teeth even every 6 months on some of these little breeds. Now, I'm not saying that's mandatory, of course, but it is nice to get in there at least occasionally with a nice deep cleaning to make sure that no disease is missed. And you can also go based off what your veterinarian says. So they can take a look in your pet's mouth and see how much tartar the buildup there is, if there's any loose teeth, and go from there. I will say there can be some pretty severe consequences of leaving disease untreated. So sometimes we see that just so much time has passed that the tartar buildup has just gotten to be too bad, and there's so much chronic inflammation that a tooth is beyond saving. So a potential consequence of not being proactive with your pet's oral health can be that some extractions may be necessary if a tooth is beyond saving. Also, as I've pointed out, a tooth can become infected to the point where it develops an abscess, and that may or may not manifest as facial swelling, but tooth root abscesses can also become a problem. Like I said on the next line, they can also develop facial swellings if the tooth root abscess is bad enough that it blows out the side of the face. And then I have seen some patients, unfortunately, that come in with broken jaws. This x-ray here shows a broken jaw from a pet with really bad dental disease, to the point that the bone was so weakened and eaten away by the infection and inflammation to the point where that bone cracked. So we see the broken jaw there right at the center of that dotted line, that dotted circle, and the two teeth on either side of that fracture have very little bone anchored around them because they're so badly diseased. So I have had patients come in where the jaw just breaks spontaneously without any sort of trauma, and it's just due to very severe dental disease. So that, not to end on too serious of a note, but that is the end of my presentation. I have just our website listed here. So I work in Culver City at a practice called Dog and Cat Dentist. We also have a location out in Woodland Hills, where the other dentist who works, for Dog and Cat Dentist goes as well. But we're in Culver City 4 days a week, and this is our website in case you're interested, or there's a lot of other information about dental health on our website too, if you want to just browse there. But I'm more than happy to bounce things back to Dr. Rawlinson at this point and to field your questions. So thank you.
Thank you, Dr. Winer. That was so excellent. I love dentistry. I know I'm such a nerd. I think probably my favorite thing when I was practicing as a general practitioner was that 2-week recheck where they're like, they didn't even know that their dog was supposed to be acting like a puppy or a cat, or it's so gratifying. And we've done a lot of that dentistry here at PetSpace. And just to see the animals be adopted and walk out the door with this beautifully clean mouth when they came in with horrendous infections, the adopters don't even appreciate it because they didn't know the before. It's such a gratifying feeling, and I just love it.
Yes.
What's that?
Well, I was gonna say too, people sometimes just get used to the smell and they think it's normal, and then we clean the teeth, or even if we have to do some extractions, but that's going to fix the problem, they're like, whoa, I didn't realize it was as bad as it got. People just get used to it.
Totally. I also love the fact that every Zoom call that I'm on always has a cat that just walks across the you're an animal in an animal community when it's my favorite thing. Yeah. So let's open up the chat for questions for Dr. Winer. I'm going to try to get to a lot of them. I know we've already had a whole bunch that have come through. You can also choose the raise hand function if you'd like, rather than chat, and we can try to see if we can switch to your video, but we prefer the chat function because I can monitor that a little bit better. So let's start with one that was here a little bit earlier while we're waiting for some other questions to come in. the, I think we get this question a lot as general practitioners, that people hear that greenies can cause problems with choking and intestinal blockage. Do you want to comment on that briefly?
Yeah, actually, that is a really good question. So greenies did have an issue in the past with choking, where it got stuck in the pet's throat or caused a blockage further down. They actually reformulated greenies, I believe in 2008 actually, so kind of a while ago, where they completely reformulated it to be more dissolvable in stomach acid. So there is still a little bit of a risk if your dog really went to town and got too excited and just swallowed it whole. It could potentially get lodged in the throat, but that's kind of true of any treat, like a baby carrot or something else you could offer your pet. So, some of it is a little bit knowing the personality of your pet and if they're prone to just gobbling things completely whole. But I do know once it makes it to the stomach, because it's been reformulated, it shouldn't have an issue deeper down in the intestines. If you're really worried about it, you could break the greenie into smaller pieces, but part of the way it works is that your dog is chewing into it. So you don't want to crumble it so much, but potentially breaking it in half. They also have large breed dog and small breed dog greenies. So potentially if you have a smaller breed dog, you'd want to get the smaller size and not just the one, if you have multiple sizes of dogs, don't just get one size fits all. They make big breed and small breed.
Right. And then also probably, a good thing is the first time you give it to them to not just walk away when they're chewing on it, right? To see what they do with it. Do they put it between their paws and gnaw on it, or do they just bite it and swallow it whole?
Exactly. Or if your pet is not going to bite your hand, you could even hold on to it and kind of have them gnaw on it while you're holding it. And that way you're really there to monitor what's going on. Yeah, great idea.
I like that. So we've had a couple questions about speaking to the usual costs for small dog periodontal treatment under anesthesia, as well as extraction, so that people can think about budgeting for this.
Yeah, it's a great question. It's a little hard to answer because every veterinarian out there is going to have different prices. So, of course, I know what we charge where I work. It's going to be more expensive to do with a dental specialist, I will preface, because you are paying for that extra level of expertise. If your pet has more routine maintenance needs, just a deep cleaning under anesthesia, maybe some more minor extractions, I do actually encourage people to go to the regular veterinarian for that level of care. We're always happy to provide that treatment where I work, and I do pride myself on having that really high level of expertise and working very efficiently. So I do think it's worth asking your regular veterinarian and reaching out to them to see what they charge. I really can't even put a ballpark on it because every clinic's going to be different. I will say a little bit, not to be too skeptical, but you do get what you pay for part of the time. So we sometimes have people who just want that lowest cost possible in the couple hundred range. I've heard of people doing cleanings for a couple $100s, but you have to think what's going into that care. Do they have the level of monitoring equipment that I have available to me? Do they really give that undivided attention? And some clinics, I'll be frank, they don't even have the veterinarian doing the work. Sometimes it's a untrained, or a technician who's a trained technician, but not trained in dentistry. So I think certain questions you may want to ask your regular veterinarian is what the cost is and what that cost covers. So who's doing the work? Is it the veterinarian? Is it a technician? Who's doing the cleaning? Who's doing the extractions? It's technically illegal for some technicians to do some types of extraction work, but I know it happens all the time. And I just know that that's, going on out there to cut costs. So it's important not only to ask the price, but what's going into that price. Where I work, my technician is helping with my anesthesia, and she's helping with client communication and, the billing and all the logistical things, but I do all the dental work. So I'm the one taking the x-rays. I'm the one doing the cleaning. I'm the one doing the anesthesia, and I'm with the patient from start to finish. They get my undivided attention. And I will say that comes with an increased cost, but I I really value and put a lot of pride in the work that I do. So something to consider. I think starting with an estimate with your primary vet is a good place to start and see if you're comfortable. And there's a lot of wonderful primary vets out there who love dentistry as well and give their patients the attention they need and are doing the work too. But if you're going to start to like kind of bargain around and find the lowest price, you may get less service as a result. And then I will say, like, sorry, I don't want to totally avoid answering the question, but when I see a pet, I also make a custom estimate for every animal. So we don't just necessarily have like a blanket cost that goes for everyone. Our exam fee costs the same for everyone, but then I make a custom recommendation. It depends the size of the animal, how many teeth it needs removed, what specific medications I'm going to use for that pet. So I do think it's worth getting that custom information rather than just like, I don't do one size fits all medicine, if that makes sense.
Yeah, that perfectly makes sense. And you're also basing it on probably how long it's been since their last cleaning and how extensive you think the periodontal disease is going to be. It is just an estimate because until you have them under, you just really don't know.
Exactly.
A couple other questions we have. One about cats. What cat toothpaste do you recommend? And do you have any advice on training a cat to accept having their teeth brushed?
Yes.
If the cat doesn't like the taste of the toothpaste.
That's a good question. So, there's a lot of brands of toothpaste out there. I highlighted PetSmile. There's also a brand called CET, and they make different chews and treats and toothpastes as well. So you can play around and try things. The paste itself is doing very little. Even there's a few brands that have enzymes in them, but it's sitting on the teeth for such a brief period. It's not doing a whole lot. So I would just find something that your cat enjoys. I mean, you could literally dip a toothbrush in tuna juice and use that. And like that, it's mostly just brushing with the bristles. So if the tuna juice works, you could try something like that. For a cat, it's going to be a little bit tricky. I would definitely try when they're calm and maybe even a little bit sleepy, and just start small. So think about it as baby steps. Maybe the first step is even just lifting your cat's lip and seeing if they tolerate that, and doing that for like a good week. And then moving on to lifting the lip and touching the toothbrush to the teeth. And once they're okay with that, going on and on. It can be very similar to other training. So for example, clipping your pet's nails, you can use a similar technique where you just touch the paw, then you touch the clipper to the paw, then you clip one nail and stop. So it's a little bit that, think very incrementally. It can be a little easier the younger you start with them because it's just kind of in your mode to do gradual training on all aspects of everything. But even an older pet can tolerate it. But again, I wouldn't get too down on yourself because I will fully admit I have a 1.5-year-old cat. I have managed to clip her nails, but I cannot brush her teeth. So, it is what it is. But if you have the time, especially right now, people have free time, it could be a fun project. Just think of what's the smallest way to make progress and focus on that first.
That sounds good. And with each new step, you're wanting to be rewarding them for each thing, right?
Yes,
so
exactly. So you can give a greenie as a treat or some other dental chew as a reward, and then you're kind of following up on that effort.
Love it. Love it. Okay. What are dental cleanings covered by pet insurance?
That's a great question. Actually, that comes up a lot. So I will preface by saying that every insurance company is going to be a little different, and even policies within companies. Unfortunately, there aren't very many out there who do cover cleanings. So if that's a priority to you and you're going to want to be up on your pet's care, I would really encourage you to ask them directly and see if there's potentially a policy you could upgrade to or a different company that may cover the cleanings. In my experience, almost all companies don't cover routine cleanings. So it can be tricky, or even extractions if they're due to periodontal disease, because a lot of insurance companies consider that kind of more of a chronic old aging change, which isn't totally wrong, but it is unfortunate it's not always covered. Broken teeth are much more likely to be covered because that's more of a trauma event than a chronic condition. Excuse me. I can't think off the top of my head any one particular company or policy that does cover cleanings, but if I can think of it, I can maybe email you, Dr. Rawlinson, because I know there's a company that just is coming out that's focusing more on preventative care. There are also different programs through Banfield and VCA if you take your pet to one of those companies, where they have some wellness plans that sometimes include x-rays and cleanings under anesthesia annually. So you could potentially approach your veterinarian if you go to a Banfield or VCA and see about a wellness plan as well. Where I work, it's not a VCA or a Banfield, so we don't honor those programs, but if that's your regular point of care, that can be a good option as well.
Great. I think we have time for two more. And I know you're going to get this question.
Yeah.
We've gotten it a few times. Let's talk about non-anesthetic cleanings.
Yes. No, it's a good question.
It's an important question,
Yes. So, a non-anesthetic cleaning, I will say there's many varieties of non-anesthetic cleaning. You can go to more of like a grooming type facility and have them clean the teeth, and they'll most likely use a scaler to scrape the tartar off the teeth. The problem with that sort of care is it's often not directly overseen by a veterinarian. And then as well, they're really mostly only getting the outer surfaces of the teeth. And if you think about it, a pet's not really going to understand what's happening to it. So if they're having to restrain your animal and kind of pin it down or wrap it up real tight and use very sharp instruments in its mouth, it can be really stressful for the animal. And then you might not even be accomplishing as much as you think, because they're mostly able to get that outer surface, not really getting under the gums or on the inner surfaces, or where a lot of the disease lays that I treat. Also, they're not going to get those dental x-rays, which give you a lot of information. So I would say to think of it more as a cosmetic procedure, as far as maybe reducing a little bit of the bad breath and a little bit of the tartar buildup, but it's mostly going to be cosmetic rather than medically based. There's some non-anesthetic cleanings that actually use sedatives, so not full anesthesia, but they give drugs to calm the pet down and make them more amenable to the cleaning. That can potentially accomplish a little bit more as far as the cleaning goes, but again, you're not going to be able to get as deeply cleaned, and as well the x-rays, and at that point there's no breathing tube to protect the airway. So even if they're not using a ton of water, any sort of blood or chunks of calculus that are coming off can go into the lungs. So there's potentially a time and place for non-anesthetic cleanings, but I wouldn't think of it as a replacement. It can be a supplement or in addition, or I have some clients who come to me every 12 months and they do a non-anesthetic cleaning in between as a touch-up, but they know that the more medically based care is going to be provided during the deep cleaning. And the last thing I'll say about that is, I've seen a few bad outcomes from non-anesthetic cleanings. I've treated dogs with broken jaws that resulted from the non-anesthetic cleaning when they're struggling, but that's a little bit more of an extreme example. The thing that worries me the most about them is it can provide a false sense of security. So I have some pets who come into me, they've had non-anesthetic cleanings every 3 months their entire life. And the owner really prides themselves on being up on the dental care. But then when I see it, it may need, 20, 30 extractions, and the owner's so confused. And I have to explain to them that what they were doing all along wasn't really treating the root of the issue, so to speak. And a good dental pun in there. And so it can provide a false sense of security. So, is it wrong to do as a touch-up or to make the breath a little better? Not necessarily. And there's some really great non-anesthetic cleaning options out there where they actually, if they see a tooth that's loose or a concern or broken, they actually stop and send them to us. So there's a few that even will be more proactive, but then there's others who will just take your money and say, okay, clean your dog's teeth, and it can provide that false sense of security.
Thank you for that. I appreciate it. One last question, because I think we're running out of time here, but um, the and this comes from people, for years I would do dentistry and everyone would be so freaked out if I told them we had to take out a tooth or three or
Yes.
whatever.
Yes.
Somebody asked a question: how many teeth can animals live without, and how do they do when they've had extractions?
That's a great question. So there's certain diseases I treat where actually the treatment is removing most or all of the teeth. Granted, those are some more extreme examples like stomatitis in cats, or even certain diseases in dogs. Technically, teeth are not a vital appendage. So it's not like your liver, your kidney, your lungs, your heart. So, it's not my first choice for anyone, but a person can technically live with no teeth. An animal can live with no teeth. If they're savable, I'm a dentist. I love saving teeth. I love making teeth, beautiful and healthy and pain-free. But my top priority is an animal's health and comfort and quality of life. And so I really only recommend extracting a tooth if it's compromising the animal's health or impacting its quality of life. And an animal would much rather not have a tooth in there than have a constant source of pain. And I hope none of you out there have had a toothache or a tooth pain, but if you know of it or have a friend, it's like so distracting. You can't focus, you can't think, you can't sleep, you just feel this pain. And animals have the same nerves as we do and the same anatomy. Their teeth are different shape, but other than that, they're pretty similar to ours. So I'd much rather get rid of that source of pain than have them live with that. And they're better at hiding the pain than we are. We're pretty wimpy, all things considered. So, I try to direct people into thinking, they can live without that tooth. There's very few consequences to losing a tooth. Maybe a few aesthetic things here and there, but I would much rather focus on their health and eliminating that source of pain. So there are some dogs I remove 42 out of 42 teeth. And if they're more comfortable for it, I feel like I've done the right thing for them. But I only remove teeth when medically necessary. So I try my best to reassure people. And luckily I'm in the position that I see at the recheck that people say, you could never even tell the difference, or my pet's actually smiling way more now than before, or eating way better than before. So I'm in that position where I see the before and after, and it's pretty much always a happy ending, even though I might have to really convince someone to let me do that extraction.
Well, you do very good work, and it's really important work, and we're so grateful that veterinary dentists exist. So thank you so much. Thank you everyone for all your questions. I'm sorry if I didn't get to every single one of them. There was a lot. Thank you again, Dr. Winer. That was really informative and really educational.
Thank you so much.
You're welcome. You're welcome. Before we wrap things up, I'd love to extend an invitation to our guests to some of our additional online events while we are practicing social distancing. Beginning in July, we only have a couple of spaces left for our PetSpace Kids Camp online for children aged 8 through 11. Be sure to register soon because it is filled up. We also have our new, you may have seen these, our new pet encounters that are live on Instagram Wednesdays through Sunday at 12:30. It's a great way to learn about our adoptable animals. You get about 15 minutes to ask all the questions you want about each adoptable animal that's highlighted. As well, we have this great interactive live puppet show for kids and adults. Actually, there's quite some funny comical moments that adults get each Thursday at 4 o'clock. And then, as I mentioned earlier, don't forget that on July 1st, we are welcoming guests back into the space safely for limited programming and on-site pet adoptions. So be sure to check our website and social media for more information. So thank you again, Dr. Winer, for taking the time to share all this great information with us. And thank you to all of our viewers. We had a lot on the call today, for joining us this afternoon and continuing to support Wallace Annenberg PetSpace. Thank you all. Be safe, be well, and we hope to see you all soon.